So hi everyone, my name is Mikey with ISCT TV and I'm here today with Dominique Farge, who is a professor of internal medicine in the University of Paris and also co-chairs the roundtables. So it's a pleasure to have you here with me today. So how are you enjoying the conference and what do you feel like has been the main talking point so far that you've taken from it?
Oh, first of all, it's one of my many attendees to the ISCT conference, and it's kind of really unique atmosphere, probably because this is an international society on cell and gene therapy, and not only based and started in America, but really expanding worldwide.
Yeah.
And as a European, I'm really convinced that we learn much, notably in terms of development and translational activity in this tricky field and delicate field of cell and gene therapy and their application. So, if I may summarize what is kind of unique here in these first 2 days are, number one, the ability to share thoughts and to learn from the others, to enrich with a typical format which is kind of unique, which are the round tables. Every morning from 8 to 9 and 9 to 10, and in the afternoon we may choose one subject or another. And because you asked me to pick up the one which impressed me the most, I had the chance to attend or to participate to one of them, which is how can or should we deviate in the future from the standardized randomized controlled trial in the field of CGT for treating rare disease. And we had a unique discussion which allows us to compare experience, notably clinical experience, difficulty. I'm a clinician and still active, and the difficulty we have to conceive and to run clinical trial, even with the best experts and the best networks, when we are dealing with very rare or ultra rare disease. So it was very interesting yesterday morning because we learned how Europe, and that's where Europe can be complementary to North America, can have different approach.
Very different.
And how the regulators may be different and have different views. The second important and very interesting session was the session run and organized by Bambi Relay, although it was a closed session and you have to register, but I think everybody should have access to that because we can hear and understand the point of view of the regulators worldwide, from Japan to North America, through Europe and Australia. So this is the number one, and there are other topics. This morning we were with Bruce Levine and other active members, the Spanish, and the unique approach in the development of CAR-T on the academic side, participants from Novartis and also the Indians, comparing how different systems worldwide may approach the development of this unique new therapy, but the cell and gene therapy in different systems. And it's not formal, but we learn from the best experts different thoughts. So this is the number one. If I may say, we have other strong, important components of ISCT, and the number two is education. Education may differ from North America to Europe and to Asia.
Yeah, for sure.
What do you think?
Yeah, no, absolutely. You know, I'm from Ireland, and the system, it's very different, you know, in different ways.
But as a European and working in the academic field, and I was very pleased to see that all the experts, whether they are North American, European, or Asian, do still believe that education is the key to get the patient to develop cell and gene therapy and to favor the access to treatment, not only for patients, but to train doctors. So one of the important components of education in ISCT is the journal, Cytotherapy, which has been run by many actors, but the editor-in-chief is Ed Horowitz, and the editorial board is very rich, so I would encourage everybody to submit key papers and reviews and original papers to Cytotherapy, which has in its own specificity, that is process development and how to get the product to the patient. And then last but not least, because I think you were amongst these early stage professionals, although you get older.
Yeah, I grow through it, yeah.
So I would like to listen from you, what is your point of view on the strengths, which is kind of unique here, of ASP committee. Personally, I've been mentoring younger people for 3 years, and it's always interesting and important to discover how you navigate through the UK system, the Swedish system, or another one. So what do you think about the ESP?
Well, I think the most unique thing about the ESPs is that I think it's the leadership who they spend an incredible amount of time to mentor us, and they're so generous with their time. And I think that I've never had so much opportunity within ISCT, and there's so much opportunity there. It's all about grabbing it, and every opportunity that's come my way, I've grabbed it, particularly with ISCT. And it's helped me develop not only professionally, but personally as well. And it's helped me set more kind of, differentiate my kind of career goals and where I want to go. And so I've just found it, and even like being on multiple committees with yourself, you know, learning just how to even say things the right way and communicate it. Like, I think that's a really amazing part of ISCT. So learning from the world leaders like yourself in this field.
Okay, I don't know who we are, but I know our task is to transmit and to help and to show the way and to deliver trust and confidence.
So on the topic of education, because I feel like this came through a lot with and through the roundtable. So you're organizing, you're helping organizing a training course in Paris in October on CAR-Ts and autoimmunity. Can you tell us a bit about that?
Yes, with pleasure. Why are we doing that? Number one, probably because this is one of the strengths of Europe where the story started, thanks to the Erlangen group, and tomorrow we have, today at the plenary they are showing their activity and their experience, and as you know, impressive results have been obtained with the use of CAR-T for treating non-malignant disease. It is a narrow field because probably not all autoimmune disease patients will benefit from this therapeutic approach, but in a subgroup of patients who have very severe, rapidly progressive disease resistant to standard therapy, we have been all fascinated by what we see. Basically, at least in lupus, it has been clearly shown now that this approach allows similar results as those we were obtaining in the past 25 years with the use of bone marrow transplantation autologous, which is a more aggressive approach. And there is an important potential. However, before delivering such therapy to patients, we really and definitely have to train the physician and the health worker force, not only the physician, but those from the conception of the drugs to the delivery, to the pharma, to the technician and the nurses. And that's why putting together all the experts from North America with Bruce Levine, the group of Erlangen with George Shedd and Mackinson, and the EBMT, European Bone Marrow Transplant Association, with Rafaela Del Greco, and the former Vice President Europe-elect Fermin Sanchez and myself, we decided to try to gather all these experts. So the course will happen in Paris on the 25th and 26th of October. But not only that, this will be kind of a unique new approach for ISCT Europe to try to collaborate on a clever way as a complementary actions with sister society. And having had the chance to be active for 25 years in a BMT and in this network of clinicians who are rather on the implementation of the therapy rather than on the development and the process to deliver the drug, we'll have the course, the educational course on Thursday, Friday. And on the Saturday, we'll be able to keep many of the KOL and experts and to update the guidelines that were published a year ago in eMedicine on immune effector cells for the treatment of rare autoimmune disease, which was published in 2024, as a combination of publication between EBMT, ISCT, FACT, JASI, and other international experts. So really, ISCT has supported the course. We want to thank them because it's a new initiative. We know it's in Europe, and we hope we'll get many people from other regions. And afterwards, the message will be able to be delivered as a CME educational course. So we invite you to come and
I'll be there.
And to motivate the youngest and the oldest to join us.
Absolutely. Yeah, because this course is being delivered by key opinion leaders, and if you haven't seen it yet, please check it out on the website. It's going to be an amazing course.
Oh yes, plus if you have 5 registered, you'll get a discount, which is very important. So we thank ISCT for doing the maximum. And that's a very nice example of how a strong society with major development, thanks to the executive committee and the experts, is able to deliver a sufficient amount of support in education, which should not be a place where you make money, but where you bring the know-how.
Yeah, exactly.
Okay.
So after this meeting in June, you're going to take up a position as chair of the EU Regional Executive Committee. Can you tell us a bit about what's planned for the coming year on this committee and what your plans are?
Okay. My plans are, number one, to serve the society and ISCT, and to try to open the mind of our North American colleagues and Asian about some of the specificity of Europe. Among these, number one, Europe is not a unique region. It is unified, but it is many countries, and probably the approach on cell and gene therapy is not the same if you work in Sweden, in Spain, in Italy, in France, or in Germany. And there is a lot of creativity. The session today on CAR-T in autoimmune and this fantastic story in autoimmune disease application is one of the examples. The development of mesenchymal stromal cells were started amongst others worldwide. We have experts, of course, in North America, Jacques Galipeau and other groups, but the Karolinska and Katarina Leblanc were the one who first demonstrated the efficacy of MSC in GVH, in the treatment of GVH, and thanks today it's being more and more interest with the recent agreement of Mesoblast. So each country and each network in Europe are able, under a common umbrella, and especially with the EMA, to have a regional approach with country specificity and creativity and knowledge. So our task will be to follow the guidelines and the objectives and the aims of ISCT, number one, to have more interest, to get the European know better ISCT. Number two, to work with a complementary approach with other European society in the field, which are using cell and gene therapy, but that may not have the same approach, basically because they are more prone in developing clinical implementation, but not clinical development. And the specificity of, for me at least, of cell and gene therapy is that you have to know what you're injecting. Using a CTG product is not using a biologics. Then we have in Europe, and if I may say so in France, but in every European country, long-standing collaborations with groups in China, not only on the use of MSC, but on CAR-T. And so that might be also a task. My task number two will be really to show to any ESP, potential ESP in Europe, that they have to behave as the Irish and the UK ESP. Probably it's a question of language.
Okay.
Because I thank the ISCT and my predecessor and the board members and the executive committee, because they have understood the price and the life in Europe is not, those who are in the medical field do not have the same standard as in North America. They have understood now that education is free in Europe, and it's an important component, so we have progressed. And then that's already a challenge, but we'll focus on education and in collaboration in terms of development. Then last but not least, with the recent development in North America, not to say more, we are convinced as Europeans that the European Medical Agency and HTA regulators in Europe will bring more information, different vision to North America and other countries. And at the end, I dream that ISCT could conceive some minimum requirements worldwide to be able to use, to deliver and use up to the clinic cell and gene therapy. An important point are registries in Europe. Per tradition, there's been many registries. It was started with the BMT. It's ongoing with the CAR-T registry, which is a joint structure between several European societies. And so we have much to do, but the future in Europe are the ASP.
The ASPs, yeah, exactly. The future leaders, yeah.
Yes.
So yeah, and hopefully we can increase engagement with the ASPs in the European community, because I think that there is a gap there to do that, and I think that we really need to plug into that. So and I will help with that, obviously.
Okay, thank you so much.
But Dominique, it's an absolute pleasure talking with you today, and I really like to thank you for your time, and I hope you enjoy the rest of the conference.
For sure.
Thank you.
Thank
Perfect.
you.